All right, so we're going to get started. Welcome to a new Current Conversations. I'm Teresa Lagerman, Events and Community Manager at the Highlands Current. We are very excited. We feel very fortunate to have Dr. Anil Vaidian joining us tonight. He is the Commissioner of the Dutchess County Department of Behavioral and Community Health. And we all have a lot of questions about what's going on again. Well, what has been going on for months and months with COVID, but it seems like, things are kind of heating up again. So we're going to be talking about the recent uptick in cases, recent orders, all the things that are happening. I'm sure everyone has questions and we want to hear them. You can submit them using the Q&A button, should be along the bottom of your screen. As we go along, we'll try to get through as many as we can. So I'm just going to hand it over to our senior editor, Leonard Sparks, so we can get right to it.
Hi, everybody. Thanks for tuning in. And thank you, Dr. Vaidian, for agreeing to do this. I frankly don't think it could have come at a better time. And the first question is, obviously, we're dealing with I think, a pretty significant uptick in cases in Dutchess and in the mid-Hudson counties. And obviously, we're not back to those dark days of April and May. But are you concerned about what you're seeing?
I think it's reasonable to be concerned, but again, you hit on the point that there's clearly an uptick of cases, and the uptick in cases, was to be expected. When you look what happened in spring, with the arrival of the pandemic to our shores, there was a lot of things that we just didn't understand about the virus, about viral dynamics, how infectious it was, some of the safety measures that you could employ to protect yourself and the community. Well, we are 9 months and more into it. And, those who are in public health understand, we know from history how pandemics, especially when viral pandemics come onto the scene, how they behave. They tend to be multimodal, meaning they tend to have multiple peaks. And what we saw in the springtime, although, tremendous in terms of the cost and the impact that is had to our state, in terms of like the lives that it has taken, the lives that is impacted on a long-term basis. But again, when you look at other pandemics, the second waves tend to be of a greater magnitude and scope. And so I don't know if people have a memory, but in the springtime, people within public health were warning, the fall is coming, winter is coming, we have to be prepared. And so all the things that we put in place in terms of containment and mitigation steps that brought the numbers from the heights that we saw during spring to manageable levels during summer were all the result of all basic public health mitigation steps. And so what is happening now is that, people are moving indoors more. And when people are moving indoors and sort of congregating indoors and having activities indoors, there is more opportunities for people who may be infectious to run into to other people who may not be infectious. So there's a greater number of opportunities for the virus to travel from person to person. And that is what we're seeing. And although we see clusters here and there, for the most part, when clusters are identified, what we find is we're fairly quite rapid and quick in our response. And so we're not seeing like clusters getting bigger and bigger and spilling over into the community. What we're seeing now is individuals in the community who are, for the most part, getting fatigued, getting tired of some of the the steps that they've taken, and maybe they're becoming more lax, meaning they're getting together. Again, I'm speaking from anecdotes that I've heard from my contact investigators. People getting together for parties, people getting together to watch football. Mm-hmm. And if everyone in that network is not absolutely adhering to the same behaviors in terms of protection, unfortunately, someone could introduce the virus into those type of settings, and that is what's occurring. So what you're seeing now in the community is greater and greater community spread as a result of more social interactions in the community setting and in household settings.
Well, one of the things I'm curious about, how much do you glean, from people who test positive in the county? How much do you glean from them about what they did or the kinds of behaviors that they were engaging in that you think resulted in them being positive?
So this is exactly right. And so, the things that we saw springtime, things like travel. There were cases that were introduced when college students came, when there was a return of all these cases from upstate New York and Oneonta and other places. And so when we do our investigations, we see, oh, that's what the link is. That's the explanation of a particular case. But what we're seeing now is that individuals that are identified as case, and we're reaching out to them and doing a case investigation, the type of exposures are really community-related activities. They're not traveling outside the country. They're not doing large trips, although they do occur. But they're not the major activities that, the cases that we're seeing right now in the community in Dutchess is engaged in.
Now, is it safe to assume that, we've talked so much about people and bubbles and limiting their social circles to just a finite number of people and family members. So are you seeing people who are starting to broaden those social circles to people who may not have been into their bubble, and at the same time not wearing masks, not social distancing, etc.?
So again, that's an assumption, okay? That's sort of like a generalization that we may take because the numbers are getting higher. And so if people indeed were restricting themselves into a small cohort of individuals, we typically would see cases. But the other caveat is you could have a small cohort, but if one person in that cohort has another network that he or she is part of, and so on and so forth, the possibilities or the network of transmission gets much larger. So again, in public health and in the disease control world, we see this quite a bit with HIV. We saw it quite a bit with STDs, meaning, I'll give you a hypothetical. I am an individual who has one partner, okay? Why would I be at risk for HIV and STD? I would be if my partner had other contacts, and that partner had other contacts. And whenever you have sort of like an expanded network like that, and you introduce a pathogen into the network, over time, it's going to filter through pretty much everybody within that network. So again, if people are restricting the number of people that they're coming into contact, how well is that network insulated? Are your family members having contacts outside in the community? Is your pal that you get together with have a much larger cohort or network of people that they associate with? So these are all factors that come into play in terms of how transmission dynamics work in a community. So You could be very diligent, but it may not be you. You may be exposed because of the lapse in behavior of someone else that just happens to be in your network.
So, obviously last week the governor announced that that the state was going to impose restrictions on private gatherings, and obviously this comes ahead of the Thanksgiving holiday. When you talk about trying to limit community spread, what kinds of things should people be doing? What kinds of things should they not be doing? Especially as we're approaching next week.
So again, I don't want to be rigid in telling people, okay, if you do this, you're going to be protected. If you don't do this, you're not. But again, I think at this point in time, I think the general community and the residents of the Hudson Valley understand how this virus is transmitted. You need person-to-person interaction. Interestingly, this virus is very, very infectious. It's not as infectious as something like measles, but it doesn't take a long time for this virus, if you're associating with individuals in close proximity, to be transmitted. And depending on the age cohort, you could have young people who could be totally asymptomatic and still pass on, COVID. And so what it comes down to is the number of interactions that you're engaged in on a regular basis. The more there are, the greater the risk. So when people congregate for a family gathering and you haven't seen your brother or sister and you have no assurances what they have been doing or whether they've been exposed, and you just introduce them into your household for a family gathering or a party or even Thanksgiving. And what is happening is these type of events or these type of gatherings is what's driving the numbers now.
Mm-hmm. Let's go to one of the questions we have. What, if anything, can be done to convince those who believe COVID is a hoax or a plot that it is real and dangerous? That's a tough one, I know.
That's a very tough one. You know what? I mean, a lot of it has to do with, I don't want to pull my psychology hat or whatever. But again, when someone is so entrenched in a particular view, if you are sort of trying to force that individual, okay, you will be met by equal force back. I think, the approach really should be, if you could have just a conversation, if he or she is your friend or part of your social network, ongoing conversations expand our understanding, our thought, and the things that we think of. And that's what I try to tell people. Arguing with somebody about things that they're so fixed on, there's no value. And so again, as a physician, when I was in practice, I would sort of counsel somebody about whether their eating habits or smoking or whatever. And, if they're pre-contemplative or they're contemplative, it depends on how far you'll push. If they haven't even contemplated, making any change, maybe that initial conversation should end. And when you get to a point where they're willing to listen to you, then you could provide more details. And so again, I think there is no right answer. I think everyone has to decide for himself or herself of how you want to deal with individuals within your family circle or social circle who may not believe on the severity of COVID. But at the end of the day, I think what's important is you're responsible for yourself. You're responsible for your actions. And your actions goes a long way on whether this virus, gets into your household or exposes your loved one. And so my recommendation to people is, the area and the social circle that you have some control over, work on that.
Now, as it stands right now, Putnam is at risk of being designated a yellow zone under the state's microcluster, initiative, and and Dutchess, at least from what I've seen most recently, you're still okay in terms of that, but I think the county executive was saying last week that you're sort of preparing for the possibility that there could be such a designation.
Right.
I don't know if it would be for county or for just a specific area of the county, but can you just explain that initiative and tell me what, if anything, you guys are doing to prepare just in case the county or an area of the county is designated as a cluster zone?
So again, in the beginning of our COVID response, a lot of restrictions and measures were taken during New York pause. But now we sort of have a framework or metrics that drive public health decisions from a state standpoint anyway. And the state has decided that, again, depending on whatever area, whether it's a census tract or a zip code, and if the number of cases, as well as other metrics such as 7-day rolling average, is above a certain threshold, then measures are put in place for schools and other areas that, like for instance, the governor saw cases rise and they put a restriction on gyms and bars and restaurants to 10 o'clock. And that is driven by the fact that, these are areas where people are congregating and that may be driving the rate. And because the threshold is there, it's exceeded, that measure is put in place. The same thing in terms of these microclusters. The problem is when you have too many of them, some of the measures that we could take to sort of ensure schools stay in place, such as testing on a regular basis, surveillance testing, to make sure that the numbers are dropping and to prove that your area is going out of that cluster designation is defeated, because essentially your area is part of a local community, it's part of a regional community, and depending on what the overall trend and behaviors are within the community at large, you could be sort of at the mercy of that overall trend. So some of the things that have come down from the state is trying to use metrics and data-driven approach to some of the public health measures that they're employing. So again, we could get into the weeds, but again, that's the hope that that the state government is sort of approaching. And I will tell you that, again, no one, probably from the governor all the way down to local communities, do not want another shutdown. And so again, the way to avoid that is sort of to target public health measures to areas where you're seeing cases rise and some degree of loss of control.
It sounds like, yeah, that's an alternative to, say, shutting down a big wide swath such as a county. Instead, you focus on the area where the area where the cases are concentrated.
That's absolutely, it's the least restrictive means to sort of bring things under control in a particular area. And they go from the smallest zip code or census tract. But again, when you have rates that are high, very high in a county or a region, then you know what, the whole designation of microclusters and all that, it doesn't matter.
Yeah. I'm going to go to another question that we received. If one wears a mask, uses hand sanitizer, and follows standard physical distancing, is it safe to do routine shopping and errands? For example, buying groceries at the supermarket, picking up prescriptions at the drugstore, etc.
Okay. So I'll couch this with this statement. Risk is not dichotomous, meaning there's no risk and there's a lot of risk. It's sort of on a continuum. And so each measure that you employ is reducing that risk. We know that, just optically, look at the United States. Those areas and states and municipalities that sort of were against some of these measures and basic things like a face mask, they are having some of the hardest issues now in terms of hospitalizations, in terms of case rates and mortality. So, but I think for the most part, New Yorkers have been wonderful in terms of trying to adhere to some of these guidance, but yet you still see community transmission. But the one thing you don't see is our emergency rooms overrun. You don't see our ICU and our hospitals inundated and at the brink of failing. And so even though we mentioned that case rates are rising within the community, and some of it is expected, it's not having the impact that it had during the springtime. And so I'm circling back to the question, which is, if you follow these steps, yes, it reduces the risk. But again, I don't think there's any physician or public health official that will tell you that it negates it and there is no risk. I will tell you what I do is I plan my shopping. I go off hours. I go late. I go at a time when other people are not there. And these are some of the things that you could employ. But I cannot stress enough how important those measures that you mentioned are, especially the mask wearing. We knew that if someone is symptomatic, that it reduces the risk of exposure to a person that is near you that may be unmasked by over 50%. Now we know that if you wear a mask, the risk to you are also reduced. So it goes both ways. More for if you're symptomatic, but still, again, if you're also employing these other measures in terms of hand and respiratory hygiene, distancing, and wearing a mask, this is the best things you could do in terms of being able to still have normal type of activities within the community.
And so, and I hate to say 100% or use that figure, but it sounds like what you're saying, if you're wearing a mask and someone you're around or in proximity to is also wearing a mask, that you pretty much have close to
over 70% efficacy in preventing that type of viral transmission. These are some of the things that have been quoted in the literature.
Now, one of the things I've been in this, maybe something you said prior to the conversation about masks, sort of made me remember this, and I apologize for not having it on my list of initial questions, but I've read that, in the 9 months that this has been going on, medical professionals have become a little bit better at keeping people alive, and that it's not quite, the risk of death is not quite as high as it was, say, in March and April, right at the beginning of this. Is that true, or?
So I will tell you that, again, the status of things now, we don't have an effective vaccine that is employable right now. we do have some treatment modalities. We know that in individuals who are severely ill, if you use a cheap steroid, it reduces mortality by at least a third. We know that, again, if someone is having respiratory difficulty, the positioning, if you lay them on their stomach, they tend to do better. So there are all these things that we've learned during that 9 months that the medical community is employing. They're using plasma, they're using monoclonal antibodies, they're using remdesivir. So all these things are being employed, and what you're seeing is they're able to deal with individuals on the spectrum of illness, from difficulty breathing all the way to requiring ICU care and ventilator.
And we'll go to one more question that was submitted. Can one safely stay in a hotel? Is ventilation an issue if the last occupant was there earlier in the day?
Okay. Again, I'm going to say it depends. I think the onus is really on you as an individual to find out, number one, what are the policies and measures that the hotel that you're going to stay in is employing? Meaning, what is the cleaning procedures after someone is there? What type of ventilation do they use? What's the air exchange? These are things that normal people, when they're traveling, I got to consider these things. These are not things that they do. But again, if you're considering staying in a hotel, these may be things that you want to take into account. And I'm hard pressed to think of establishments and facilities that have not looked at this in detail and have not employed these these measures. And so, again, I think people should make due diligence of whenever they travel and ask, because all establishments are the same. But again, if I had to travel, I would not be so concerned. I just would ask the right questions.
Well, and speaking of travel, I have to travel, and I have to travel of all places to Florida, and I'm taking plenty of masks with me. But I'm going to use the governor's new test out option as opposed to doing the 14-day quarantine when I get back.
Okay.
So I'll get a test in Florida within 3 days of leaving, and I'll get a test 3 days
after.
Yeah, after I get back to New York.
Mm-hmm.
And of course, after I get back, I'll just hang around the house for a few days, which I'm doing a lot of anyway. So with testing, what's the, I know earlier in this pandemic, it was really rash, the testing was really rationed. Where are we now in terms of criteria for testing, and where should people, if they want to get tested, what should they do?
So again, I can't speak for the region. I can speak for Dutchess. In Dutchess County, it took quite a while for us to get to 1,000 tests a day. But just a couple of days ago, we were over 2,000, 3,000 tests in any given day. So in terms of the availability of testing, the availability is quite robust within Dutchess per se. But the things that really is important is why are you getting tested? Is it because you're symptomatic? If you're symptomatic, are you using an antigen test? Are you using the PCR? These are all things that fall under the purview of a physician or a clinician to work with you on that and to explain the differences on what a test means, what a positive means, what a negative may mean or may not mean. And so there is no one flat answer for testing. I think it all depends on what your question is. Like for instance, the whole rationale behind the testing for an individual that's traveling is we know that individuals who become symptomatic typically develop symptoms or you can symptoms between 3 to 5 days. After exposure, after 2-3 days, if you have COVID, the test more than likely will pick it up. And so that's the rationale of doing it before you travel. And that's the rationale of doing it, after you travel. But again, I also would advise people that, again, if you were exposed, say at the airport when you were traveling, some people may take up to 14 days after an exposure to either develop symptoms or develop COVID. So that's the only caveat. But again, some of these changes are all trying to balance risk benefit. And so I think, having the test before and after are reasonable things, and your decision to sort of stay in the house is a good one too.
Well, sure, and we'll drive down, so we're avoiding the airplane. So should people still, if they, people think they've been exposed or they feel some or any symptoms, should they call their doctor first or should they go?
Okay, so this is what I want to make clear. I think in terms of bang for the buck, in terms of the most important thing that individuals can do to sort of limit, the circulation of this virus is when somebody is symptomatic, not to expose others. So again, if you're symptomatic, you should be at home, but you should be starting a dialogue with your clinician or finding a way of ascertaining whether indeed my symptoms is due to COVID and not to flu or some other respiratory illness. There are only very few things that are highly consistent. If you lose, smell or taste, okay, that's very consistent with COVID-19. But again, it could be just, a range of symptomatology that could be due to a URI or the allergies or whatever. But indeed, because it's so non-specific, it behooves individual to think about, I have to know what this is, and I have to make sure I don't expose my colleagues. I'm not going to go to work. I'm going to connect with my clinician. I want to make sure this is indeed not COVID before, The other thing is, once you find out you are COVID positive, of isolating for the recommended period of time and making sure that those individuals that you potentially expose know about that exposure. Because if people know their status, whether it's an exposure status or that they're positive, more than likely the vast majority of people are going to do the right thing and not continue to expose other people. And so they will change their behaviors if they know their status. And so these suggestions are things that anyone could do to not only to protect their loved ones in the community, but also prevent the transmission cycle from going on and on.
And let me ask you, and I think we're just a couple more questions, but one, in terms of active cases, obviously in Dutchess, they've been up over the last month and a half, 2 months. And what populations are included or excluded from the Dutchess's count of active cases? And for example, are prisoners at Fishkill Correctional Facility included? Are students at Marist who test positive, are they students or staff, are they included?
Thank you. So actually, part of the case count, if they're considered Dutchess residents, meaning we do break out the cases. And, for instance, there were initiatives where they were testing in correctional facilities, and we saw blips or increases in numbers. And when we broke it out, oh, there was an initiative, it's in a nursing home or in a correctional facility. So again, the dashboard is an indication of people that are tested, okay? And obviously, oftentimes people test because they're curious or they're symptomatic. And so we know that those that are test positive are only probably, people have all seen this, the tip of the iceberg. There may be an undercurrent of cases that are in the community that are there but never got tested. But the case numbers are valuable because they give you a sense of overall trends. So again, if drastic things are not changing, meaning the reasons why people get tested, or the population is being skewed in terms of who's getting tested, maybe if the colleges no longer start testing their clientele, then what we could glean and generalize from those numbers would be different. But these are things that we in public health know. We have an idea who's testing, where the numbers are coming from, whether it's students, whether it's individuals who are residing in adult care or nursing homes or in correctional facilities, or is it general community wide residents. And this is why earlier on when I said that, again, what's driving the numbers is community spread, is because we are able to tease out, looking at the case counts, it's not from a nursing home, it's not from a college, but it's from, sporadic cases in the community.
Okay. And last question. With the better treatment, is the number of positive cases still a good indicator of coming hospitalizations and deaths? What is the best marker of how we're doing?
So I think when you're dealing with, like in any typical year, the flu, affects about 15% of the population. The reason why it affects 15% of the population is every year people are getting flu shots and there is some built up immunity. What's different about COVID-19 is it's a pandemic because the human population has never seen this virus. And this is why potentially, without immunity through natural illness or through a vaccine, basically the entire population is susceptible. Okay? But you say with treatment, whether case counts change. Is that your question?
Well, I think we were. I think the question is referring to what we were talking about earlier of sort of better, involving treatments, and I think maybe the big essence of the question is also looking at the number of positive cases. Is that still a good indicator of coming hospitalizations and deaths? So should we automatically say that certainly compared to say March or April,
I think in terms of indicators, it's something that I look at and that I have concerns for, basically because if you look at the rest of the country, whenever you see cases go up, it takes roughly, the lag is between 2 to 4 weeks before those cases end up as hospitalizations and end up as ICU stays or end up as potentially someone who's deceased, okay? And so if I'm seeing numbers increase now, these numbers may portend or suggest that in like a couple of weeks, that the number of hospitalizations and ICU stay may increase. And so yes, there is a lag, but if we see cases rise dramatically, then I'm concerned for the healthcare system.
Okay, well, let's wrap it up. And I want to, before we break, I want to just mention you're now just let people know you're now doing updates, Facebook updates, video updates. Is it twice a week now, or just?
I will tell you, it's that this was not my idea, but but you know, it is an effective way to reach people with trends and things that we're seeing. And so to my communications teams and the county's communications teams, I think, you know, I've gotten feedback that, again, that they actually heard what I said and thought it was valuable. You know, in public health, we tend to be in the background and off the stage or off the screen, but nonetheless, there is value in getting messages out. Because again, I think what you're doing is valuable, because people have to understand that with regard to COVID, you know, there are a lot of things that we can't dictate. We can't dictate when we're going to get the vaccine. We can't dictate, you know, the medical advances in terms of treatment, but we could dictate our behaviors. And so I think truly it's in people's hands, you know, over the next several weeks, looking at Thanksgiving, looking at Christmas, looking at New Year's. How am I going to continue the healthy behaviors that have kept me well since COVID came to our shores? You know, am I going to continue, or am I going to sort of like have some backsliding? And there's always risk when, you know, we sort of like have breaches in how diligent we are. You know, we get, you know, colds throughout the year. You know, what people don't realize is you got a cold because you probably touched a surface or touched something and touched your nose or eye. So it was a breach in what you typically do. You know, maybe you were very diligent with hand washing, but had that breach. Well, you know, this is somewhat same, but on a much more greater level. It's COVID, and COVID could land you in the hospital. COVID can put you in the ICU or even kill you. And so, you know, it's in our hands on whether we continue to be diligent, continue to be strong and steadfast in continuing the things that have kept us safe, kept us healthy, and our community healthy until, you know, for the past 9-10 months.
Okay. Well, thank you, Dr. Vaidian. And we certainly don't want to wear you out before tomorrow's press conference. So, but thank you. This has been great, and you know, there's plenty of COVID information on the county's website.
Absolutely.
And obviously plenty in the Highlands Current. So, and this.
I want to thank you for inviting me, and to your viewers that again, they should really look at where they could access up-to-date, reliable, and accurate information.
Yeah, thank you. Okay, thank you, and thanks everybody who tuned in. So.
Have a good night, everyone.
Yeah, thank you.
Thank you, everyone. We will be posting the recording of the conversation online tomorrow morning for those who couldn't tune in. And yeah, there were a couple of questions that didn't get answered because we went over time, but we'll try to get answers for those as well. Thank you, everyone. Have a good night.